Chapter 15, Trace Minerals, Screencast 3. This screencast will be focusing on two trace minerals, and those are going to be manganese and iodine. If we look at foods that are actually really good sources of manganese, we start to see a pattern here. Generally, proteins are the best sources of many of our trace minerals. In this situation, we're actually looking at plant-based proteins being the best source. Here we see walnuts, lima beans, and peanuts. Manganese is absorbed in the small intestine via simple diffusion and active transport. 5 to 10% is absorbed, and it depends on diet and iron status. It's transported bound to alpha-2 macroglobulin, and this will take it to the liver, bound to albumin, alpha-2 macroglobulin, or transferrin is how it will get to other tissues within the body. It will be excreted via bile. The functions of manganese are similar to zinc and copper. Deficiency of manganese is not well documented, but symptoms may include nausea and vomiting, poor growth and skeletal abnormalities, impaired carbohydrate and lipid metabolism, and also abnormal reproduction function. Toxicity will actually cause severe neurological impairment, and the upper level for manganese is 11 milligrams per day. The next trace mineral that we'll be looking at is iodine. And if we look at good sources of iodine, probably one of the primary sources in how we probably get the majority of our iodine is through salt that has been iodized. If we look at one of the extremely high sources, we see seaweed. Now, iodine is found in food in iodine form. It's absorbed efficiently within the small intestine and is going to be transported to the thyroid gland once it has been absorbed. Sodium-dependent or sodium-linked transport systems will trap iodine in the thyroid gland for the synthesis of thyroid hormones. It will be excreted in the urine. Now, one of the most important roles of iodine is it is an essential component of thyroxine T4 and triiodothironine T3. I will typically limit these to T3 and T4. T4 is actually the circulating thyroid hormone, but T3 is going to be the active form of this hormone. There are a number of enzymes that are involved in the conversion of T4 to T3, and this is a process that actually requires selenium. The singular function of iodine results in widespread consequences. And one thing to keep in mind here, it plays a vital role in maintaining normal metabolism, as that is what we really see the functions associated with thyroid hormone primarily. Now, if there is an iodine deficiency, there is a disorder known as endemic goiter and endemic cretinism. And this will occur when iodine is insufficient. So a decrease in iodine results in decreased levels of T4. Thyroid stimulating hormone secretion will increase. The thyroid gland will enlarge to increase trapping of iodine. And this is where we actually see a goiter. Kind of imagine the thyroid going into overdrive in an effort to try to produce thyroid hormone, but it can't because the iodine is not present. This also contributes to the hypertrophy and is known as goiter, and this will also result in a lower metabolic rate. Deficiency is of particular concern during pregnancy because of the developing fetus. If a woman experiences an iodine deficiency during pregnancy, the consequences can be especially severe. It may cause congenital abnormalities, a low birth weight, numerous neurological disorders, result in impaired mental function, poor physical development, and actually result in death. The disease known as cretinism, it is characterized by severe mental retardation, loss of both hearing and speech abilities, short stature, and also muscle spasticity. Now, this particular image here is showing us iodine deficiency disorders worldwide, and as we can see, for the most part, there are few countries that do not experience this. one of the reasons why we don't actually see a lot of iodine deficiency in the United States is due to the fact that our salt is fortified or has iodine added to it. Now, the upper level for iodine is set at 1,100 micrograms per day. And when we talk about toxicity, some of the things that may happen are enlargement of the thyroid gland, a decrease in thyroid hormone synthesis, hyperthyroidism, autoimmune thyroid disease, and even thyroid cancer.